Broadly, there are two types of diabetes, type 1 and type 2. Insulin, as we are all aware of it, insulin is pretty much necessary for our life. It is a must, right? But what is more important with insulin is you have to understand what is the biological action of insulin. The biological action of insulin is to control the glucose within a normal level. Let it be like 80 to 120 milligrams per deciliter. It has many biological actions. Let it be anabolism, let it be anti-catabolic, but most important action is to keep the blood sugar within the normal limits. And it acts as a messenger to every cell to accept the glucose to come inside. Without insulin, even if the cells are swimming in a pool of plenty of glucose, it cannot absorb the insulin inside. So insulin is absolutely necessary for your cells to absorb the insulin inside. So what happens in type 1 diabetes is there is no insulin production, right? So just because there is little production of insulin or no insulin, we are supposed to give them insulin injection. Without insulin injection, the patient, type 1 diabetic patient, will have a very poor prognosis. Whereas in type 2, as we all see in this picture, there is plenty of insulin. There is also plenty of glucose circulating in the blood just because the cells are not able to absorb the insulin inside. So this is what is called insulin resistance. So type 1 is due to deficiency of insulin and type 2 is due to insulin resistance, and often there is increased insulin production. You have plenty of insulin. At least 90% of type 2 patients have increased insulin production.